Hi, so last time we discussed Joe's history and case formulation, and today I'm going to spend some time going over the treatment plan using the CBT model. Joe and I have been meeting once a week for 45 minutes per the requirements of the program at this facility. Since we began therapy, some of the goals we discussed working on include improving his self-esteem, decreasing negative behaviors, increasing more positive behavioral skills and activities, and then developing healthier ways of thinking. During the process of making goals and planning, we really focused on Joe participating in and having a voice in the direction of treatment to make sure he agrees with the goals we are setting and has an opportunity to have a sense of control in his life. So one of the first things we'll work on together is orienting Joe toward the model of CBT to help him understand the structure of therapy and be more engaged in the process, which will happen both in session and outside of session with materials and homework assignments that are appropriate for Joe's age and level of understanding. So next we'll start out with some behavioral interventions. These will be easy, attainable goals to get the momentum going in terms of Joe feeling successful, decrease his distress, and give him some evidence that CBT is really effective. And this will happen by learning some relaxation and breathing techniques to practice when he is feeling upset or overwhelmed. Due to Joe's experiences in a negative environment and relationships, he would also probably benefit from some assertiveness training so he can better communicate his needs to others and develop more confidence in building relationships. And then moving on to one of the biggest areas we'll focus on, which is teaching Joe to recognize and track his thoughts and subsequent emotional reactions and behaviors. The next step of the process will be to actually challenge and confront some of these automatic thoughts or beliefs, which will involve looking for evidence, looking for alternative ways to think about a problem, or considering what the implications are for thinking in this way. This process may eventually reveal some cognitive distortions Joe may have developed as a way to cope with his negative environment, such as dichotomous thinking, where he thinks he's either a good or bad person, catastrophizing that ignores a possible positive future, or personalizations in which Joe believes he's the cause of all negative events. In the long term, my hope is for Joe to be able to recognize these distortions and replace them with more adaptive ways of thinking. And then in the final stages of the therapeutic process, whether or not we determine that schema therapy is appropriate for Joe at that time, is to make a relapse prevention plan that will hopefully allow him to maintain positive changes he's made in therapy and not fall back into old patterns that once helped him make sense of his negative environment and relationships.